Does hyoid suspension affect your voice? Have you ever wondered how a surgical procedure might impact your voice? Today, we will explore the effects of hyoid suspension on vocal quality. Hyoid suspension is a surgical option used to treat obstructive sleep apnea by stabilizing the hyoid bone. This U-shaped bone in your neck supports the muscles of the tongue and throat. The surgery involves pulling the hyoid bone forward and securing it to nearby structures like the thyroid cartilage. This helps prevent airway collapse during sleep. Now, let's talk about how this procedure might affect your voice. The hyoid bone plays a role in speech because it connects to muscles and ligaments that help move the tongue, larynx, and epiglottis. Since hyoid suspension changes the position and mobility of this bone, it could potentially alter voice quality or function. However, it is important to note that significant voice changes are not commonly reported as a primary complication. Most patients do not experience lasting voice alterations after the procedure. Instead, the complications associated with hyoid suspension more often include infection, pain, or issues with the surgical hardware, such as broken or dislodged screws. While infections or inflammation near the surgical site could cause some swelling or discomfort in the throat, this is not a typical outcome. In most cases, any voice changes that occur are likely to be minor or temporary. They may be related to the healing process rather than the surgical repositioning itself. Patients considering hyoid suspension should have a discussion with their surgeon about potential risks, including any possible effects on their voice. This conversation can help clarify individual factors and any variations in surgical techniques. To sum it up, while the hyoid bone is involved in voice production, the primary goal of hyoid suspension is to improve airway function for sleep apnea. Most people do not experience noticeable or permanent changes to their voice after the surgery. If you are thinking about this procedure, it is wise to ask your doctor about any concerns you may have regarding your voice.